This is another case of a lady with a lung lesion, no histology, but very suspicious for lung cancer. And she has mediastinal and abdominal nodes under the liver. I find it's pretty rare to get abdominal mets with lung cancer. It's possible. And I also find that it's pretty rare to find occult liver mets with lung cancer. I don't know why. You find it more with esophageal cancer, pancreatic cancer. But for some reason, the lung cancers, if the CT is negative, you tend to not find anything else on the EUS. So here we go. Respirez bien. This balloon is leaking on me here. Technical difficulties. Hold on a sec. Just leaking under here. All right, here we go. Vous allez sentir le tube dans la bouche. Respirez bien. Voilà. Penchez la tête vers l'avant. Avalez un petit coup. OK, merci. Restez sur le côté comme ça. Voilà. Okay, so take a quick look at the mediastinal nodes. Those are for sure malignant. No question. And then AP window up here, not much going on there, okay? Pulmonary artery, aorta right there, nothing going on there. So we'll go into the abdomen now, look at her liver. See if there's any signs of a liver met. This looks good, torquing. There's the vein coming out of the liver down here. No, not that. Right here. There we go, following that. Okay, and then there's her pancreas. You will occasionally find pancreatic mets as well. Okay, going out to the tail. So I'm not seeing any nodes so far that look really bad here. Let's look at her right here. That doesn't look good. Okay. So the problem is that I can probably do this from the stomach, but I'd have to go through a lot of pancreas. So we'll do it more from the bulb, I think. And for sure, we're going to do this node first because for the lung lesion, I think this would be probably M1, whereas the mediastinal nodes would be N2 or N3. So we're going to try and get this. I'm going to go into the bulb. Tu peux appeler Dr. Garipi, s'il vous plaît? In we go. Okay, so this node we should see in the bulb. Torquing up to the hilum. Voila. We'll do a duodenitis. Go left. Where is it? Where is it? There it is, right there. Huge node. OK. Donc, je vais prendre l'aiguille, s'il vous plaît. This is portal vein. Hepatic artery, probably some bile duct there. So this is a 22 gauge needle. Again, ouais, c'est ça. OK. Madame, il faut rester sur le côté, s'il vous plaît, comme ça. OK, so in position, needle out. I've got good trajectory there. Could probably push in a little bit. Tip down a little bit. There we go. Okay. So once I'm up against the node, you can see I'm up against the node. You just want to go in, stop, make sure you know where the tip is, then back and forth. A little bit of suction just to waste time. Suction. Again, I come out of the lesion behind the wall and go somewhere else to really make sure I'm sampling new tissue. If you come out of the node and go back in somewhere else, I think you automatically have to get fresh tissue because you're going into a completely different part of the node. I have to keep my tip down here to try and keep this. Okay, there we go. Okay. Okay. There we go. Okay, so that's it. So we have no stylet, so the syringe is on the needle here. So I just take this. We don't use the stylet to push anything out unless it gets clogged. So she's going to just point this at the, go over there, go to the slides. And so I'm just taking the air and pushing it on like this, and I just push it all onto 2 slides. That's it. All the material on 2 slides, that's it. Okay? We don't make multiple slides. I figure the more we concentrate everything on the 2 slides, it'll spread it out like this. Then I put the spray, and that's it. So it's very fast. He's gonna have to. Il faut que je te colle ça là, hein, c'est ça. And he's gonna. Then I put it in here for him, and then he gets to work on staining them.
So again, what we do now is we use the Diff Quick Stain, which is a very fast staining procedure. Takes less than 30 seconds. So 15 seconds in each of the staining solution. Then when we're over with the staining, I'll go directly to the microscope without any cover slip on the slide. Usually it's enough to make a diagnosis. We don't need a cover slip, but if it's a more difficult case and we need the cover slip, I'll put it on. So now we can look at the slide. The slide is very well stained. You see, it's bluish material, so you can see here it's blue. So it means there's a lot of cell when it's blue. As you can see, it's pretty fast. Smear is good. Cells are very well preserved, well stained, and obviously malignant. It's a non-small cell carcinoma.